Hello, health fan. Did you know that colon cancer is the third most common cancer diagnosed in both men and women in the United States? According to the American Cancer Society, the average age at the time of diagnosis of colon cancer for men is 68 and for women is 72. And they also estimate that the number of colon cancers in the United States for 2023 are 106,970 new cases of colon cancer, and it's expected to cause about 52,550 deaths during 2023. The National Cancer Institute has said that approximately 4.1% of men and women will be diagnosed with colon cancer at some point during their lifetime. Welcome to an important topic that could potentially save your life. In this video, we'll be talking about the top 10 early warning signs of colon cancer that you absolutely can't afford to ignore. So grab a pen and paper, take some notes, and let's get ready to learn about the red flags that could be lurking in your body. Trust us, this information could be the key to catching colon cancer early and staying on top of your health game. Number 1 on our list is loss of appetite and unexplained weight loss. Any form of unexplained weight loss should be a source of concern to anyone. Unexplained weight loss means any form of weight loss that happens without any effort. In other words, you did not exercise, diet, fall sick, or go on diuretic pills to lose weight. In colon cancer or any type of cancer, weight loss is a major sign that accompanies this condition. In this case, weight loss usually stems from a lack of appetite and the feeling of fullness. Also, abdominal pain or cramps can be deterrent when it comes to consuming solid food. It is not uncommon to see those diagnosed or not even diagnosed with colon cancer prefer semi-solid or liquid food because liquids are easier to digest, especially if the tumor is progressing, and it also helps with abdominal pain. Number 2 on our list is change in bowel movement. This may seem like an insignificant sign because, eating the wrong food could change your bowel movement. But in this situation, we're talking about extended periods of time. And yes, we know that if you change location and cuisine, it may take some time for your bowel to normalize. We're not talking about that either. A change from hard stool to watery stool and back again, ongoing for over 6 months, requires at least a medical opinion. Number 3 is narrowing of your stool. Trust me, I know how that sounds too. When your stool narrows, especially if it changes down to a pencil-thin shape, may indicate colon cancer-related narrowing or obstruction. You see, when a tumor starts growing in the intestine, it narrows the passage of food in the intestine. This in turn changes the shape of the stool to a straighter, thinner shape to accommodate the obstructed intestine. Number 4 is a change in stool color. When it comes to talking about this sign, we have to break it into 2 parts. The first part would be a dark colored stool. Now, before we proceed, you have to understand that there are other conditions that could cause you to have black colored stool. Sometimes food like black licorice or blueberries can cause black stool. Pepto-Bismol can also turn your stool black because of the bismuth compound present. Another simple reason your stool could be black is if you're taking iron supplements for anemia. Other conditions include esophageal varices like ulcers and upper GI bleeding. The second part is if you have a bright red stool. Besides colon cancer, other conditions that could make your stool bright red are hemorrhoids, lower GI bleeding, anal fissure, or cut. Even drinking beetroot can cause your stool to be bright red. However, if for any reason your stool is bright red and it's not from taking beetroot, we suggest you see a doctor. Number 5 is cramping or abdominal pain. Abdominal pain is a symptom of a lot of gastric-related diseases. Even some problems in the reproductive system can manifest as abdominal pain. Just having indigestion can manifest as abdominal pain. Let's not forget that when women have their menstrual period, one of the symptoms is crippling abdominal pain. I know that you may be wondering why I am listing all of these out. Well, it's for you to have at least some knowledge of what to rule out if you do start noticing some symptoms. Your first call should always be to your doctor. Also, this is to note that abdominal pain related to colon cancer can be intermittent, or it can be a constant dull or sharp pain that can go on for months. Getting an abdominal scan would be a productive step. Number 6 is bleeding from the rectum. Yes, it can occur from straining to passing hard stool, hemorrhoids, or even intimate time with your partner. And yes, there are all acceptable reasons. But in the case of colon cancer, rectal bleeding, there is normally no provocation. You could just be sitting down eating popcorn and ice cream, watching a movie, and you suddenly feel a slight drench. After inspecting your underwear at home, you dismiss it, but then it keeps getting worse, and it could be dark or bright red blood, or you may go to the toilet and just a little strain to poop, and there is a lot of accompanying bleeding. If for any reason you notice this, please consult with your doctor. Number 7 is bloating. Bloating is defined as swelling or feeling fullness in the body. Now imagine this. You have not had a meal and you know your body. You should be hungry. But for some reason, you don't have the appetite to eat. And this goes on for quite some time. You eat little food and you're losing weight all around your body except your stomach. Now, this bloating may be associated with mild or severe abdominal pain, or it may not be associated with pain at all. If for some reason you notice that you or someone you know is hardly eating, but his or her stomach is always looking bloated, or that person tells you they always feel full even when they have not had a meal, it may be a good thing to advise the person to see a doctor. Number 8 on the list is frequent gas. I think this is self-explanatory, but just in case it's not, let me explain better. If you used to fart just twice a week, or maybe only when you eat beans, or if you're lactose intolerant, but over an extended period of time, you notice the gas becoming consistent without any of the dietary triggers, then it would be wise to consult your doctor. Number 9 is constant weakness and fatigue. There are a lot of conditions that could cause someone to feel constantly weak and fatigued. And yes, I will list them because I know you want me to. They include anxiety disorders, chronic infection and inflammation, acute kidney disease, other types of cancer, different types of anemia, etc. Usually, you will always have a combination of bloating and frequent gas in colon cancer patients. Number 10 is anemia. This is due to the fact that colon cancer bleeds into the intestines and can affect the colon of the stool. It changes the color of the stool to black. Anemia caused by this kind of blood loss is peculiar to colon cancer. For those who do not know, anemia is when you have a low red blood cell count. Over time, this blood loss can cause constant fatigue and dizziness and weight loss. Well, there you have it. These are the 10 early warning signs of colon cancer that you should not ignore. It is important to note that these signs could also point to other conditions and not just colon cancer. This is why you should always consult your doctor. If you experience any of the above symptoms individually or a combination of 2 or more. Also, colon cancer has a high survival rate if caught early on. Have you or any of your loved ones been diagnosed with colon cancer? How did they find out? What were the first signs that they noticed? Let us know in the comments section. We'd love to hear from you.